Thank you for joining us in our series of health talks. Today, we are going to look at labor complications in labor. And we are going to look at obstruction, fetal distress, and bleeding. Obstruction, I mean obstructed labor. So, to start with, as we all know, labor is the most difficult stage in pregnancy. It's the final phase and the most difficult because it is attendant with many complications, one of which is what I listed above: obstruction or obstructed labor, fetal distress, and excessive bleeding. There are others, of course, such as injuries to the baby, injuries to the mother, and even death. We are going to be taking these three one by one. First, obstructed labor. Labor is said to be obstructed when there is failure of the baby or the baby's head or presenting part to progress and get delivered during labor. It is usually said to be mechanical because it is a problem between the fetal head or fetal presenting part and the maternal pelvis. If it takes more than 12 hours from the onset of labor to the delivery of the head or the presenting part, labor is said to be obstructed. So what are the causes? So if we have a baby that is presenting obliquely, what we call malpresentation, the baby cannot progress to pass through the birth canal. And if the baby, for example, is a large baby, for a small woman, maybe is large because his father is large, or he has, or the mother had diabetes, blood sugar in the pregnancy, the baby will be large, and the passage will be small. So these are some of the few causes of obstructed labor. When obstructed labor occurs, the most difficult or dangerous problem that occurs to the mother is vaginal fistula, what we call VVF, vesico-vaginal fistula, a condition that allows dribbling of urine uncontrollably. But to the baby, what happens is there is a distress or fetal distress, the next topic that we are going to look at. So what is fetal distress? Fetal distress, as the name implies, means the baby is in distress. And technically, it means the baby is not getting enough oxygen. The commonest cause of this is, as we talked about, obstructed labor. But there are other causes, for example, cord compression or separation of the placenta from the womb of the mother. All these can cause the baby not to have enough oxygen flow in the body. Another problem that can cause fetal distress, especially coming from the mother, is maternal diseases such as hypertension, low blood volume, anemia as we call it. They can all predispose the baby to this fetal distress. So how can you prevent your baby from getting distress? Obstructed labor and fetal distress, because they go hand in hand, can be prevented by ensuring that a woman attends early and regular antenatal care in the pregnancy. So there, the doctors and the midwives will determine if there is going to be an obstruction, and they will prevent that, so that together it will prevent any fetal distress. The third complication we are looking at today is hemorrhage or excessive bleeding. Excessive bleeding in pregnancy is very dangerous to the mother if it happens after delivery. But another type of excessive bleeding can happen before delivery, and it's very dangerous to both the mother and the baby, what we call antepartum hemorrhage. Antepartum hemorrhage or excessive bleeding before delivery is usually caused by trauma, a kick to the abdomen of the woman, or sudden disruption of the placenta to the uterus or to the womb of the mother. But postpartum hemorrhage, that's the hemorrhage, excessive bleeding after delivery, is usually caused by uterine atony. That is, the uterus has a problem in contraction. There is a problem of contraction of uterus after delivery. So some injuries like laceration of the mother during birth can also bleed and can cause excessive bleeding. So these are all the complications that we are going to look at today. To prevent hemorrhage, regular attendance at antenatal care will determine the causes and the risk factors that will preclude a woman from excessive bleeding, and so it can be prevented very early during the pregnancy. Thank you for listening, and see you next time.